What we've found is that seaweed actually reduces period pain, substantial amount, significant and substantial amount, by eating small amounts of seaweed every day. You may well ask, how did a couple of older gentlemen get into the business of seaweed and dysmenorrhea? Well, it starts back 4 years ago when we were discussing with CSIRO. We saw some research which said if you fed seaweed to cows, you could stop cows farting methane, and that was really great for the global emissions. Gray, my partner, lives in the Philippines. We knew we grew seaweed there, and so we decided to grow seaweed at scale. As we grew seaweed at scale, we realised that we had to add value to it, and one of the things was liquid fertiliser, so we've actually established a business in Philippines which grows liquid seaweed fertiliser, and we sell it throughout the Philippines. But all along, right from starting the business, we knew that seaweed had a whole bunch of really active compounds. Researchers over 40 years had used it for antivirals, they'd used it for novel antibactericides, for novel fungicides, for things in obesity related issues, and in some areas they've done it in cancer. So I met Professor Jane Tees out of the US at a seaweed conference in last year, and she'd been looking at seaweed and reduction of breast cancer and why the Japanese had 1/10 of the breast cancer rates of those in the Western world. Now, she had given her patients in a clinical trial, she'd given them dry seaweed in a capsule. Well, we were looking at this and said, why not? Too easy, so we put our seaweed that we grew, it's organically grown, and we put it in the capsules with a local nutraceutical manufacturer, and we introduced it into the area of to our friends and other people in this demographic, the older, and had symptoms of metabolic syndrome, hypertension, which is elevated blood pressure, elevated sugar levels in their blood, elevated lipids, and there was some work going on in dementia and inflammatory bowel in Europe. Now, what Jane Tees had said and what Professor Lindsay Brown from the University of Southern Queensland had come out with was this stuff actually works. Professor Brown had done it on animals, those results came out in humans, and we got a range of other things that were really quite surprising. Back in Philippines, Gray has had some boarders staying in his family home, and one of them, Carol, as part of the family, she ate seaweed. After the first period, she came and said, look, my periods had been on a pain scale of 10 out of 10, or at least 9 out of 10, or 11 out of 10 sometimes. It's gone to 1. We were really intrigued. Was this something else that we could look at? I was recounting this story to my daughter, who's a 41-year-old person here, and she'd always had dysmenorrhea, painful periods as a child. In fact, all my daughters did, and she's had children, but now she's actually, when she looked at the pain scale, she said, mine's gone from from an 8 plus down to a 3. We're even more intrigued. It's been 4 months now. Every one of those months that Katie has had a period, it's been pain scale no more than 1. For the past 5 years, she was incapacitated, basically went to bed for 2 days, box of NSAIDs. So we've gone out and we've now got 140 in a pilot trial to see, were these couple of isolated cases, were they typical, were they one of a kind, or were they typical? Well, we're delighted to tell you, and we'll do it in the subsequent video, about how people are reporting now that their pain has gone from where they've had to spend 2 days in a darkened room with a box of painkillers, to basically normal life. We're excited.